So one of the biggest applications that we found with the Accusorb that we use on a daily basis with our abdominal work is with the arm sleeves. Instead of bringing the patient's arm above their head, which can be quite tiresome for a 15 to 20 minute procedure, even longer, we now put the sleeves on the patient's on their arms while they're by their side, and this allows us to have a little bit more time not rushing through our procedure. But also for when imaging in the phase plane right to left, we no longer have to use a no phase wrap. The RF shields work well to absorb the signal and does not allow any anatomy to wrap in the image, allowing us to decrease our phase, shortening our scan times quite significantly, in some cases even by about 30 to 50%. Okay. In the case of the leg wrap, we found a few different applications for it. One big one is that we use it for our elbows. Instead of now putting everyone in the swimmer's position or what's known as the Superman position, which can be quite tiresome on the patient, dealing with patient motion, a lot of repeats involved. Now you can take the coil or the RF shield itself, wrap it somewhat around the body as the patient lays supine, and position your coil on the elbow. And without having to use a no phase wrap, the shield itself eliminates the signal, and we're able to image with greater success, less repeats, more patient comfort, which is again one of our biggest areas that we try and focus on. If the patient is comfort, there's a greater chance that they won't move as much, less repeats, less time to scanner, more patients through. So there's quite a few applications involved. Another big one is that we've used it in a circumstance where we couldn't do a patient in our regular coils because she presented with a locked knee in a 45 degree angle. So in that case, what we came up with is our next best coil that we had was a very large phased array coil, a 48 centimeter coil. So with the patient positioned in a left cube with the knee of interest down on its side, we're able to place the leg shield over the other leg, which laid right on top of the other knee, which in any other circumstance your images would look pretty awful. You'd have a lot of aliasing, a lot of wrap, and it wouldn't be possible, but the shield worked quite well itself to eliminate, almost disappear, remove the other leg from the images, and allowed us to acquire fairly good images and allowed us to diagnose the patient's problem. So in that case, that would have been another patient that wouldn't have been able to be done unless these RF Accusorb shields were possible.